Hello, healers. Hello, warriors. Welcome back to my platforms. I am streaming in multiple places, and I apologize for the quality of the camera, of the video. If you're watching this on video, if you're listening to the podcast, you can watch the version of this episode on my YouTube channel, but I'm also streaming into the Wellness Corner NJ Instagram and Facebook. Okay, if you're new to me, you don't know who I am, this is your first exposure to me. My name is Dr. Jennifer Genty. I am a functional medicine practitioner. I really, really love all things natural medicine. My goal is to bring back old medicine, like what our ancestors used to do, bring it back into modern day so that we can not only identify the root cause, but also utilize herbs and spices and Chinese medicine and lifestyle changes and other tools and resources to help us heal our bodies the intracellular way. Okay. At the time I'm recording this, it is March 2024. And I have to tell you, it is very stressful time for a practitioner like myself. Why? Because we are seeing so many people getting sick, from respiratory to weak immune system to hormonal imbalance to hormonal weight gains to the fatigue and the brain fog. Like, people are literally getting so sick, and we are seeing a slew of people coming to our clinic here in Denville, New Jersey. We also provide telemedicine services as well for people out of state who desires to work with a practitioner like myself. Okay. We introduced a new term, and again, if you are new to this platform, I'm gonna just go over it briefly. But if you're not, then you already know the term that I'm gonna reference. It is called confunctional medicine, where conventional medicine meets functional medicine, right? We do exactly what you would get done at your primary care doctor, a conventional, and then we help you identify the root cause. We also help use a non-pharmacological tools, right? Like medications and other things that doctors are doing. We don't use those modalities. We use the herbs to reduce inflammation, to remove toxins out of your body, to also help you heal and regain energy, regain brain function, eliminate your gas and bloat and acid reflux, get brighter skin, balance your hormones, lose the weight, the unconventional way. Okay, so I wanted to introduce myself real quick. I am super excited, and you can tell when I'm excited, when I'm like, the words can come out fast enough. That's the excitement within, because I am so looking forward to this message, to release this message. I'm so looking forward to share this with you. Now, every so often we do promotions here in our clinic, because I'm always looking for ways to help my patients not only save money, but also heal the bodies, okay? Heal your bodies at a lower cost. Heal your bodies at an affordable cost. And every month we do webinars, but also every 3 months or every quarter, at the end of every quarter, we also look at ways we can help people by decreasing and reducing some of our fees in our clinic. And that's what I want to talk to you about today. Okay? All right. If that sounds good to you, so let's get into it. This month promotion, only for 2 weeks, the promotion is going to run for 2 weeks, is IV vitamin therapy. Okay. And I know many of you guys don't know what IV vitamin therapy is, or you heard about it, you have no information, or the thought of, intravenous is creating fear and scarcity, and you want to know more. So the first thing I'm going to do, I'm going to talk to you about why we all of us, including me, healthy or not healthy, need to have IV vitamin therapy as part of your treatment. Okay. As part of your protocols, as part of your programs. I want to talk to you about that first, and then we're going to go into the promotion briefly, and then I'll do several videos educating you on, all things IV, so that you can have the knowledge. If you choose to join us on this promotion, then you are welcome to. But first, I want to give you the information so you can make an informed decision if you want to, allocate your funds to IV vitamin therapy, because I can be biased. I love IV vitamin therapy. I know it is the future of medicine. More and more practitioners are implementing IV vitamin therapy in the clinics and the practices. There's even mobile IVs. Like you can actually call a company and they can come to your house and do infusions. This is what celebrities are doing. Okay, this is what healthier people are doing. This is what the stars are doing. Like before we knew about IV vitamin therapy, they were already doing it. I remember watching a video with Rihanna, the rapper, and she mentioned how after every single concert, she will do IV vitamin therapy. And then at that time, she had a video or picture of her getting infusion for hydration, getting infusion for energy. Okay. But again, you don't know what you don't know. I didn't know what I don't know. The way I was introduced to IV vitamin therapy, that's when my father had cancer, right? My father had cancer. If you know my story, this is how we opened Wellness Corner NJ here in New Jersey. It's out of, helping my dad, helping me, and getting frustrated with working with a practitioner that did not allow me to really treat people and help people the way I want to. I was told that I have to hurry up and see people, see 30 people in an hour, 50-minute slots of, I can see 5 people in 1 hour. And I felt unfulfilled. I felt that I wasn't really making a difference. So here I am. I opened Wellness Corner NJ, okay? And since then, we've been helping a lot of people. But my background is in emergency medicine, urgent care medicine. And guess what? In the emergency room, every single human beings that, came in on the stretcher, they all received hydration. That is the first thing we used to do. I mean, if you walked in if you walked into the emergency room, they will triage you and put you aside. But if you if you came in on a stretcher, you will have somebody insert a needle into your arm and give you fluid. Why do they do that? Because they know feeding your cells, okay, putting all the things inside of your body intracellularly can greatly benefit you. Okay? It takes time when you ingest something to your mouth for your cells to receive the nutrients. It takes time, right? Because there's a process that has to take place. You have to go through breaking it down and, absorbing it and also processing it, right? But when you do intravenous infusions, whether it's IV vitamin therapy or any medications that, people are infusing, practitioners are infusing in the ER, your cells, your body can receive it very quickly. And that's the secret to IV vitamin therapy. Is the absorption rate with IV vitamin therapy, the absorption rate is 100%. If I were to create a bag for you, okay, and I create an IV vitamin therapy bag for you, and I'm putting B vitamins, all the B vitamins, I'm looking at your immune system, and I'm looking at viruses, I'm looking at all the things, and I put all the goodness into the bags, guess what? You're getting 100% versus me giving you a pill. Versus me giving you a pill, you're only getting 5 to 10%. So IV vitamin therapy happens to be my secret sauce when I was introduced to high-dose vitamin C for cancer patients, because that is the gold standard IV vitamin therapy for all cancer patients, whether you're receiving, chemotherapy, radiation or not, you all need IV vitamin therapy, because when you infuse the vitamin C into your cells, you are boosting your immune system. You're feeding your cells all the nutrients that they need. They revive, they come alive quicker and faster. You can repair and restore quicker and faster. That is the beauty of IV vitamin therapy. I always choose IV vitamin therapy for promotions in my practice because I want my patients to feel better quicker and faster. It can take you like months to regain, energy. It can take you weeks to fight an infection. Weeks. With IV vitamin therapy, if you were to do 2 or 3 infusions per week, and then you just stick with it and you just do your best, right? When you go home, you change your diet, you incorporate things that are, that's adding to the IV, you will feel better quicker and faster. IV vitamin therapy happens to be my secret sauce to me healing my body. I have a lot of tools in my toolbox that's keeping me healthy. Haven't gotten sick in over 8 years, not even a sniffle, no allergies, no nothing. And I'm not saying that because I am, I'm perfect or whatever. That's not even close. I'm not perfect, but I am gonna share with you things that I do, because people ask me, well, Dr. Genty, how do you have so much energy? And how do you go on? And how come you can sit here with the patient that have COVID and flu virus and immune system and you don't feel a thing? Because my immune system is working for me. My immune system is the only thing that can actually save me when I'm faced with an allergen, when I'm faced with a sensitivity, chemical sensitivity, food sensitivity, when I'm faced with a virus, when I'm faced with a bacteria, I am not immune. Like I don't live in a bubble. So I am literally exposed to all the things that you and everybody else is exposed to. But guess what? Guess what the difference is? I have a stronger immune system. I have a stronger foundation. I worked on that for years, right? So now it's paying off. And I had to do what I had to do. And IV vitamin therapy happens to be the number one focus, the number one tool that I use to boost up my immune system. Okay, so why IV vitamin therapy? Because you get 100%. One thing you guys have to understand, if you're new to IVs, because I know I have some, people that have received IVs before. I have some people that have never heard of IVs, or you're not even thinking about IVs. They never like put it aside. Like, I don't want to deal with this. This is not true healing. IV vitamin therapy feeds your cells. It is mostly for your cells. Your body has trillions and zillions of cells, and they need to work for you. In order for you to have energy, your cells need to create energy. You need to give them things to give them energy for you to have energy. In order for us to move, right? Like mobility, your cells have to work for you. Many of us are not thinking about ways to revive and cater to ourselves. We don't think about that. When in fact, disease is a cellular process. So many people are getting respiratory infections out there, right? They're getting the flu, they're getting the RSV, they're getting COVID, they're getting whatever, bronchitis, they're coughing up a storm, and they are not getting better, right? They're still experiencing long COVID because they never focus on the immune cells. One thing I have to tell you, if you were sick and you were symptomatic and your body fought for you, right? And you become asymptomatic, that means no symptoms, doesn't mean like the virus is still not in you. You still have to do things to get rid of the virus or to decrease your viral load, and which is what people are not understanding. And IV vitamin therapy happens to be one of the tools that can help you do exactly that. Okay? With IVs, you get 100%. It is one of those therapies. If you go to a clinic that specializes in IVs, I've done IVs for years, all you have to do is show up. The practitioner can literally help you with, putting all the ingredients in that bag so that you can feel better. We use IV vitamin therapy here in our clinic to manage illnesses, to help with diseases. This is not one of the tools that we use as an elective thing. We actually use IVs for diseases, right? There's an IV that you can infuse into your body that you can receive for every single disease. Whether you have high blood pressure, there's an IV for that. Whether you have diabetes, there's an IV for that. Whether you have immunity, weak immune system, there's an IV for that. Whether you have, frequent infections, sinusitis, or, COVID, like respiratory, you coughing, like whatever, there's an IV for you. Okay, so in our practice, we use those ingredients. They are preservative-free. Preservative-free. We don't like toxins because our purpose here is to decrease toxins. So we cannot be putting toxins into your body. So they are preservative-free, they are potent, and they work. Okay, and they are safe. We'll talk about that in another video of questions that we get. Is the IV vitamin therapy safe? Very safe if you go to a clinic that knows what they're doing. Okay, so we need IVs as a tool more than ever now, with people getting sick and not recovering, people getting frequent respiratory infections, people getting frequent UTIs. You got to think about your immune system. You got to think about your immune cells. Okay, when you get sick so often, you have to. And that's one of the things people do not consider, right? We take the pills, and sometimes those pills, you got to take multiple to get the dosage on that battle. Sometimes you got to take 3, you got to take 4, you got to take 6 to get the dosage. And sometimes those vitamins have binders and failures in them, and you are not getting the right, You're not getting the right vitamins. You're getting the binders, the fillers, and the preservatives. So that's why if I'm able to help my patients get better, quicker, and faster, if they're open to receive the recommendations, IV is always, 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 always my go-to to help my patients. So for the month of March, we are releasing a promotion for our patients, and anybody that's willing to learn and see how IVs can help them. So the promotion that we have for the month of March is, are you ready? Free will. You can choose whatever IV you want for $250. What? So in previous promotions, we used to select, okay, so this, quarter, we're going to do vitamin C or we're going to do antiviral. I'm noticing since people are getting so sick, people are not getting better. So I just going to open the menu for you. You get to choose whatever IV you want for $250. The only IV that you don't have access to, you will not be able to choose is the ozone therapy, because ozone therapy is a different ball of game, right? So ozone therapy is not included, but you can have a vitamin C IV for $250. You can get an energizer IV for $250. You can get the antiviral IV for $250. You can get the weight loss IV for $250. Weight loss IV for $250. You can also get the chelation IV for $250. You can get the hydration. Now, the hydration IV, as it is now, it is $230. To make it up to that price, if you were to get hydration, we're also giving you a glutathione push at the end. Okay, because I want to be fair, I want to be transparent, and I want to honor my word. So when I looked at the hydration IV, since it's only $230, I believe, we are going to give you a glutathione to push it at the end of the hydration IV. And glutathione is good for immune system. Glutathione is good for your liver. Glutathione is good for the brain. So there's so many benefits in glutathione. Okay, you can research it. There's so many informations out there. But yes, this is open menu IV for $250. Yes, you get to choose which IV you want for $250, minus the ozone. Ozone is a procedure that we do here in our clinic, but it's not an IV, right? And it takes a lot of time. Minus the ozone, minus the NAD, because NADs are like 4 hours. And with NADs, I have to be very cautious of who get to choose NADs, because you can get a lot of reactions with NADs. So we don't do NADs and ozone. But vitamin C, $250, antiviral, $250, wellness IV for $250, blood pressure IV for $250, energizer IV for $250, hydration IV for $250, hydrogen peroxide IV for $250, and also chelation IV for $250. All right. So I'm going to do many videos and talk about each one, because again, many of you guys never heard of these IVs. Like, what? Do I need them? You do. You really need to include IV. Another thing I'm going to do, because I know this video is getting very long. Another thing I'm going to do is that when you do IVs, you cannot do one infusion. And that is a misconception people have. They think they can just do one IV and then they are cured. No, 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 no. You don't do one. Because remember, the nutrients, the micronutrients that we are putting in the bag for you has to replenish. And many of us have a lot of deficiencies, or many of us have a lot of malabsorption or malnutrition. Many of us have a lot of depletion of vitamins, so that one bag cannot identify, the deficiencies that you have. So you cannot do one bag and be like, oh, I did it, I'm cured. No, I usually recommend 4 to 6. 4 to 6. For sure, as you are thick, and then those 4 to 6 has to be infused close together throughout the week, so that you can start loading your cells up with the nutrients, right? If we are being honest with ourselves, we are being realistic. We cannot just do one bag and be like, I did one bag, Dr. Genty, I still have no energy. I did one bag, Dr. Genty, I still have, I'm still fighting with my infections. No, No. That's the misconceptions. I'm gonna do a whole video about that, talking about the misconceptions, why people choose not to do IVs. We'll talk about price. We'll talk about, what you learned. Yes, you can start seeing a change after one IV. Yes, you can, and you probably will. But that change, that improvement is short-lived. Okay, it's not one of those things that's gonna last a long time. Okay. And always, I'm always going to be honest with you, because at the end of the day, you get to choose what you want to do for your health. You get to choose what you want to do for your body. I'm not here to tell you what to do, but I am here to give you the information. One bag, I don't care who tells you where to go. One bag is never sufficient to give you the results and the improvement. You need to feel your best. So I usually recommend 4, okay? But for the 6 is way better, but 4. But if you come into us and we have all these, issues, and we don't know, like I or Deborah doesn't really know much about your health, so we usually recommend 4 to 6. But if you are a patient of ours, we've worked you up, we've identified the root cause, we've done some blood tests, some functional medicine testing, then we give you specific recommendations to start with. All right, so that's the promotion for March. Again, I'm going to do more videos. If you want to see the video version of this, if you listen to this on the podcast, head over to Dr. Jennifer Genty YouTube channel. Should be in the links posted below. If you're watching this on Instagram or Facebook, and you want to just see all these little tiny clips that I just did in one short videos, like one standing, you can also head over to our YouTube, and that's where you're going to get all the information. For this week and next week, I'm going to talk about IVs, because again, whether you choose me or you go to the next IV vitamin therapy place, I want you to get some IVs into your body. Okay? I want to get some IVs. So if you are interested in learning more about the promotion, which is that choose at your will for $250, that's the promotion. Like, you get to choose out of these IVs that I listed, minus NADs and ozone. Like, all the other IVs are yours, literally yours. You can do viral, you can do energy, you can do vitamin C. Like, literally, people that do IVs that follows my recommendations, they feel good. They feel good. Now, when you leave, you go home, whatever, like, you got to change to really extend the improvement, to really feel your best longer. You have to really do some things at home, okay? Because it's one bag. We are in control of what we give yourselves. It's one bag, but when you go home, I'm not in control of what you put into your body. All right? So if you're interested, this promotion is going to run until, what is the date? March, into the 3rd week of March. Reach out to us, schedule your IVs. You get to call us and tell Marilyn which IV you want, and then she'll just book you. And then you have by the end of April to use it all up. By the end of April to get those vitamins into your body, okay? Because I'll do a video and talk about why we have deadlines or expiration date to the promotions. But that's what I wanted to release to you. And on the next video, I'm going to talk about why we went, the other reasons why we went in the promotion, and why I think even if you do 2 IVs, you should really explore the IV vitamin therapy world. Okay, so thank you so much, and then stay tuned for the next video. Oh, one more thing. Don't forget to subscribe and share this, please, because a lot of people don't know how powerful IV vitamin therapy can be, how necessary it can be for them on this journey. And, again, I'm going to do different short, brief videos talking about each one and why you would choose each one and what the job of each one can do. Okay, so if you're interested, stay tuned, listen to our podcast, go over to YouTube. If you on Instagram or Facebook, they are on IG, Wellness Corner New Jersey, Wellness Corner New Jersey, on both platforms. All right, so let's get you some IVs. Let's revive your cells. Let's bring them back up, okay? So they need help. And I can't wait for myself and Deborah to meet you. Okay? Give us a call and then we'll schedule you.